Aphorism 289. All the above mentioned methods of practicing mesmerism depend upon an influx of more or less vital force into the patient and hence are termed positive mesmerism. An opposite mode of employing mesmerism, however, as it produces just the contrary effect, deserves to be termed negative mesmerism. To this belong the passes which are used to rouse from the somnambulic sleep, as also all the manual processes known by the names of soothing and ventilating. This discharge by means of negative mesmerism of the vital force accumulated to excess in individual parts of the system of undebilitated person is most surely and simply performed by making a very rapid motion of the flat extended hand held parallel to and about an inch distant from the body, from the top of the head to the tips of the toes. The more rapidly this pass is made, so much the more effectually will the discharge be effected. Thus, for instance, in the case where a previously healthy woman, from the sudden suppression of her catamania by a violent mental shock, lies to all appearance dead, the vital force, which is probably accumulated in the precordial region, will by such a rapid negative pass be discharged and its equilibrium throughout the whole organism restored, so that the resuscitation generally follows immediately. In like manner, a gentle, less rapid negative pass diminishes the excessive restlessness and sleeplessness accompanied with anxiety sometimes produced in very irritable persons by a too powerful positive pass, etc. Explanation. In this aphorism, Dr. Henneman has given idea about animal mesmerism and mesmerism. All the above mentioned methods of practicing mesmerism depends on inflow of more or less vital force from mesmerizer to the patient. Hence, these all methods are termed as positive mesmerism. An opposite mode of employing mesmerism with its contrary effects termed as negative mesmerism. In this negative mesmerism, passes are used to arouse from somnambulic sleep, walking in sleep. All the manual processes in negative mesmerism are known as soothing and ventilating. In negative mesmerism, there is discharge or letting out of vital force accumulated in excess in individual parts of the system of undebilitated in excess in of undebilitated person. This process is carried out very surely and simply. It is performed by making a very rapid motion of flat extended hand held parallel to and about an inch distance from the body, from the top of the head to the tips of toes. This pass is made more rapidly so that discharge also will be made more effectively. For example, in the case of previously healthy woman whose menses are suppressed by the violent mental shock, lies as if dead. In such a case, vital force is probably accumulated in the precordial region, will be discharged by such a rapid negative pass, and its equilibrium throughout the whole organism is restored. So that resuscitation, recovery, or correction of physiological process follows immediately. In the same way, a gentle, less rapid negative pass diminishes the excessive restlessness and sleeplessness accompanied with anxiety and sometimes produced in very irritable person by a too powerful positive pass.